Low iodine diet. It's a diet which is recommended to many thyroid patients. But do you know what is a low iodine diet? How much iodine you should be consuming in a low iodine diet? What all foods you can eat and what all foods you cannot eat? Why low iodine diet is advised? And if you are going to take a low iodine diet, what all care and precautions you need to take? What is the rationale behind the low iodine diet? If you don't know, then stay tuned with me because we are going to discuss that in our today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, a hormone specialist doctor from Mumbai, India. Now, before we begin this video, one important information. If you want to watch this video in Hindi language, then on the I button and in the description box below, there is a link. If you click on that link, this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक मौजूद है. अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. See, low iodine diet is a very important diet for a thyroid patient. Okay, but what is this low iodine diet? Is it recommended for everyone? Answer is no. See, first of all, let's understand what is the normal dietary allowance of a iodine consumption in a healthy normal individual. See, 150 microgram iodine per day is a recommended, and because most of the individuals eat iodized salt, we get the iodine from the iodized salt. In fact, when we consume even a 1 teaspoon of iodized salt, it nearly gives us 300 to 400 micrograms of the iodine. That means only a salt is sufficient enough to meet our iodine requirement. In fact, it is found in many researches that most of the healthy individuals overconsume the salt, and that means we overconsume even the iodine, and we consume nearly 300 to 400 micrograms of iodine per day. So that is what the normal individual is. Now when we talk about the low iodine diet, it is a diet wherein we restrict your iodine consumption to 50 microgram per day, and this recommendation is by American Thyroid Association. Many other thyroid associations are also there which recommend anywhere around 80 to 100 microgram, but usually when we say the low iodine diet 50 microgram, that means 1/3 of your normal daily requirement is what we advise. Please understand that low iodine diet is contains iodine, however in a smaller quantity. It is not a no iodine diet, means it is not a diet wherein your iodine consumption should be zero. There has to be 1/3 of a iodine consumption at least as per the normal healthy individual, and that is a 50 microgram. And when we talk about the iodine, it is one of the very important micronutrient. Our body needs iodine for production and manufacturing of a thyroid hormones. So hormones like T3 and a T4 hormone production, we need a good amount of the iodine, and most of these iodine we obtain from the food products and what we consume on a day-to-day basis. And that is the reason why when we talk about the low iodine diet, what food you should eat and what food you should not eat becomes a very important. Okay. Now let's understand that why low iodine diet is advised. See, the scientific rationale behind the low iodine diet is that we want your thyroid gland to undergo into a hunger or a starvation for the iodine. See, whatever food we consume, that has a iodine, and when we consume that food, the iodine gets absorbed, and most of this iodine gets stored in the thyroid gland, and thyroid gland utilizes this iodine for the hormone production. That is a normal scenario. But when we give you a low iodine diet, we are purposely making your thyroid gland starve for the iodine. Why do we do this? See, this is mainly done for a medical purpose, and it is actually a therapeutic diet. When we say a low iodine diet, please understand, it is not any kind of a fancy or a fad diet. It is not a diet for you to lose weight. For that, we have a plenty many other varieties and a healthy balanced meal diet you can take. But when we say low iodine diet, it is not for each and every individual. It is there only for a certain type of a thyroid patient who has to medically undergo into low iodine diet. So don't take it as a fad diet and start following low iodine diet. This diet has to be done under the medical supervision, and if you are not a right candidate for low iodine diet, you should not attempt for it. Especially if you are a pregnant woman or if you are lactating mother, never ever attempt for the low iodine diet unless and until it is advised to you by a healthcare professional. Okay, so the main purpose of the low iodine diet is to starve your thyroid gland of the iodine. So why do we do this, and which all people are actually should follow the low iodine diet? See, low iodine diet is advised mainly for two conditions. First, if you are going to undergo any kind of a thyroid scan wherein we are going to use a radioactive iodine, or if you are going to undergo through radioactive iodine therapy. Now, these therapies and this kind of a scans is usually advised to the people who have a hyperfunctioning, means overfunctioning of their thyroid gland, that is a hyperthyroidism, and many types of a thyroid cancers. That means this low iodine diet is advised in hyperthyroidism and a thyroid cancer patients, especially when they are planning to undergo radioactive iodine therapy and radioactive thyroid scans. Okay, now let's understand that when you can start this low iodine diet. See, low iodine diet is usually recommended to begin 1 to 2 weeks prior to undergoing this scan or a radioactive iodine therapy. And once your therapy is done, after that, within 2 to 3 days later, we usually ask the patient to stop the low iodine diet and then consume to the normal iodine diet. See, when we do the radioactive iodine therapy, in that kind of a medical treatment, we are going to give you a special kind of a iodine, and this is actually a isotope of iodine, what we call it as a radioactive iodine. So when we give you radioactive iodine for the treatment purpose, your thyroid gland will accept this radioactive iodine only when your thyroid is starving of the iodine. If your thyroid gland already has a sufficient quota of iodine, your thyroid gland will not absorb this radioactive iodine, and the whole purpose of giving you the radioactive iodine for the treatment will fail or may not give you 100% result what we are expecting. And that is the reason why, to improve the outcome of the radioactive iodine therapy and these scans, we give you a low iodine diet. Low iodine diet should not be continued for a very long period of time, because by doing so, we are going to make you more and more deficient of iodine, and in fact plenty many other nutrient deficiencies can also happen, and that's the reason why it is not advised to continue for a long period of time. Another problem which can happen if you continue to follow low iodine diet without the medical recommendation is that if your body goes into the deficiency of a iodine, you have a higher chances of having iodine induced thyroid imbalances. You can also have an enlargement of your thyroid gland, what we call it as a goiter. To in fact prevent this goiter and this thyroid hormonal imbalances, most of the salts are iodized salt. In fact, there is an iodine fortification is done so that we meet our daily iodine requirement. Another important point which needs to be kept in mind is that please, low iodine diet is not a zero iodine diet. Also, low iodine diet is actually not a no salt diet. Now, what do I mean by that? See, when we talk about the iodine availability, most of this iodine is available to human consumption in the form of a salt. And that's the reason why when we say low iodine diet, the major focus is shifted on the salt. Now, when we say salt, technically a salt is a sodium chloride by their chemical nature. Okay, so when we add a iodine to it, we actually make a sodium chloride which is fortified with the iodine. So many people confuse low iodine diet as a no salt diet. It's not that way. When we say the salt, it has a sodium chloride and a sodium. And the sodium is also very important for the balancing of our blood pressure. Many times people get confused with the low iodine diet that they should not consume a salt, and they try to stop the salt consumption altogether, and that can cause a lot of imbalance of sodium level in your blood, and that can also fluctuate your blood pressure. So if you have a blood pressure problem, hypertension problem, and if you are taking a medication, and when you take this low iodine diet, you need to keep monitoring your blood pressure to check is there any change. Many times it is found that because people cut down on the salt consumption, the blood pressure also falls down. And on top of that, if they continue to take their blood pressure medication, hypotension or a low blood pressure can happen. So to avoid that, it's always advisable that you keep checking your blood pressure. Okay, so that means it's a low iodine diet, and it is not a no iodine or a no salt diet. You can continue to take a sodium chloride, a normal salt which is non-iodized. That means you can consume non-iodized salt. Having said that, the salts like a kosher salt, salts like a Himalayan pink salt, they contain a very low quantity to negligible quantity of iodine. So when you are on a low iodine diet, you can switch over to these salts for your salt requirement. One more point to be kept in mind is reading a nutrition label. Yes, very important. See what happens, the most of the food what we purchase from outside, from the market, who are ready to eat or who are ready to cook. So such kind of a food products are processed, and these food also contains the salt. And most of the salts used by the commercial companies are a iodized salt. So that is the reason why it is very important for you to read the nutrient label which says what is the iodine content. See, again, iodine, considering a trace element and a micronutrient, many times the nutrient label does not mention iodine percentage. Okay, in that kind of a situation, you should read whether does it contain a iodized salt or does it contain a rock salt. So if any of such words are there, you have to avoid this. That means when you are on a low iodine diet, it is usually advised that do not consume ready to eat or ready to cook or a readily available meals. The best option during this time period of around 2 to 3 weeks maximum will be a home cooking, and wherein you are not going to use the iodized salt. Okay. One important care you need to take when you are on a low iodine diet is that the certain food dyes. Yes. Especially a food coloring agent like a red dye number 3, or also known as E127 in Europe and United Kingdoms. So this particular dye is very commonly used in a food preparation, and this dye usually imparts a color of a red, orange, pink, maroon, okay, or a brown color. So when you consume any food which is of this color, you need to avoid it. Many times such dyes is also used in many capsules, medicines, and even in a cough syrups. So you need to avoid such kind of a medication and a food products which impart this color. Many times what happens is that the manufacturer do not mention that they have used a red dye number 3 in their ingredient list, and then if by mistake if people consume, that will be covering up your iodine consumption, and that will in fact make your low iodine diet a failure also. So you need to avoid such kind of food products. And also many of the medications, as I told you, that the cough syrups and the pills and capsules and the medicine like amiodarone also has a high iodine content. So if you are taking such medications, you need to speak to your doctor whether do you need to change the medicine or not, and you follow your doctor's advice. Do not do any change on your own. Another very important point is the antiseptic solutions, especially betadine. Now this betadine also contains the iodine, so that also you need to avoid when you are using a low iodine diet. Also many medications, especially the multivitamins which are over the counterly easily available, also contains the iodine in a smaller quantity. So make sure that if you are taking any such multivitamin medicines, read the content, and if there is an iodine, you need to avoid for this period of time. Also very important is that the herbal supplements, many times many herbal supplements also contains the iodine. Many supplements like a seaweed or a kelp tablets and their supplements, iodine tablets, they all are iodine rich, so you need to avoid them when you are on a low iodine diet. One advantage of a low iodine diet which you can experience during this time period is that you might find that you need to take a lesser dose of your blood pressure medication, and because you are restricting your salt consumption, so many times many people find that the water retention and the bloating also reduces. And because most of the ready to eat and processed food, they all contain iodized salt, and that is what is refrained during this low iodine diet, so many people find lot of improvement in their body weight also, and in fact people lose weight. And once you start losing weight, you might even experience that your blood sugar is also changing. So make a note of that and make sure that you speak to your doctor if you are taking any kind of a diabetes medication, and it might happen that that period of time your medication dose also might reduce. Now let's see what food you can eat and what food you cannot eat. To make it simpler for you to understand, I will tell you the food you should not eat, and in replacement of that, what alternative you can consume so that your life over this 2 to 3 weeks does not stop. Okay, so first and very foremost is the salt. So what you should not eat is the iodized salt and sea salt. So these salt products should not be consumed at all. Instead of that, alternatively, you can use a kosher salt or a Himalayan pink salt. Talking about the spices and herbs, yes, you can have all the herbs, whether they are fresh or whether they are dried. So herbs like oregano, basil, thyme, all such herbs you can include. However, if you are using a ready to use a herbal condiment mix, then in that case you need to be careful, because many times this spice mix also contains a salt. So if it does not have any kind of a salt, you can use a plain fresh or a dried herbs on its own. And in India, many people use various masalas. So you can have all those masalas wherein there is no addition of a salt. So masalas like a chas masala or a chaat masala many times contains this iodized salt. So those kind of a masalas you need to avoid during the low iodine diet. Second category is the fish, seafood and a seafood derivatives. See, all the food items which is obtained from the sea, you have to avoid 100%. See, all the seafood products contains a very high amount of iodine, and this is what you need to avoid during your low iodine diet. So whether we talk about the fish or a shellfish, you have to avoid. All the seafood products like a nori sheet, seaweed, kelp, sushi, maki, you have to avoid. Seafood derivatives like algae, agar, algin, alginate and carrageenan, you have to avoid completely. Try not to consume seafood products during your low iodine diet. Third category of food is the dairy and dairy products. See, during the low iodine diet, you should not consume any kind of a dairy products. All products which are obtained from a milk, then milk products like a yogurt, butter, cream, cheese, buttermilk, you have to avoid completely. Many kind of a protein powders are also obtained from a milk products such as a whey protein, casein containing, caseinate containing and a lactose containing powders, again you have to avoid. Any kind of a dairy creamers or a ice cream also you have to avoid during the low iodine diet. See, many a times, many thyroid cancer patients are on a tube feeding, and while they are on a tube feeding, many kind of such protein powders are usually recommended. So if you are taking such powders, please speak to your healthcare professional or your clinical nutritionist. They are going to help you that instead of such products, what you can switch over during the low iodine diet. Next category is the meat. See, in a day, you can consume 150 to 170 grams of either meat or a poultry products like a chicken. However, make sure that do not consume any kind of a organ meat like liver, but you can have other meat related products. Always when you select a meat, it has to be fresh. Try to refrain from purchasing ready to eat and a ready packaged poultry or a meat products which is very available in a frozen form, because many of the times they use salt as a preservative. So if you are going to consume meat or a chicken, you can consume, however they should be freshly available and should not have any kind of a salt or a brine coating. Okay, now let's talk about the eggs. Yes, see, eggs you can consume, however you have to avoid egg yolk. See, one large egg has a nearly 16% of your daily allowance of the iodine content, and most of this iodine is present in the egg yolk. So if you are consuming egg, try not to consume egg yolk, but instead of that you can have a egg white. Now let's talk about the certain soya products. See, soya products also interferes with the iodine, and that is the reason why any kind of a food which is obtained from soya, whether it is soya milk or whether it is tofu or a tempeh or miso, that you have to completely avoid. Instead of that, for your protein requirement, you can consume all the forms of legumes, beans and lentils. Talking about the nuts, you can have all the nuts. However, try to avoid any kind of a salted nuts. Instead of that, you can have a plain raw nuts. You can roast them if you want, but however, salt should not be added. You can also have a popcorn, which are not again salted one. You can make your popcorn at your home without adding any kind of a butter or any kind of a iodized salt. All the food preparation you can have, however, they should not have any kind of a iodized salt, they should not have any kind of a egg yellow, and they should also not have a dairy products. Otherwise, you can consume even a bakery products. Having said that, many times the readily available bakery products, whether it is a bread or any kind of a bakery products, they all contain a iodized salt, and many times they also use a dough conditioner, and such dough conditioner also contains the iodine, and that's the reason why bakery products which are readily available should be avoided. But yes, if you are baking at home, you can consume them. Again, a rule has to be remembered: no egg yolk, no dairy products, and no iodized salt. Otherwise, you can have them. You can again also have all the grain and the grain related products. You can have a cereals, you can have a pasta, you can also have a rice, but again non-iodized salt has to be used. Many times what happens in many of the ready to eat cereals, the red color is added which has a red dye, so that also you need to avoid. Now let's talk about the vegetables and fruits. You can consume all the vegetables, however those vegetables has to be fresh. Try to avoid using a frozen vegetables, because many of the times to freeze them the salt is added as a preservative, so avoid that. If you are consuming potato, try to avoid potato skin, because that also has a higher iodine content. Even a spinach is found to contain a higher level of the iodine. You can also consume cruciferous vegetables like cabbage, broccoli, cauliflower, kale. However, consume them in a moderation, because they interfere with the iodine absorption. You can consume all the fresh fruits, there is no problem with that. However, try to avoid any kind of a frozen fruits, especially if they add any kind of a food dye which is a red in color. Now let's talk about oil, butter and spreads. So first is the oil. You can consume all kinds of a vegetable oil including soybean oils. Secondly, talking about the butter, you do not have to consume any kind of a dairily available butter or any kind of a cheese spreads also. So instead of that, you can switch over to non-salted nut butters like a peanut butter or a cashew butter, which does not have any kind of a salt added. So you can make such butters at home, so you can make sure that there is no salt added, because most of the ready to eat butters, they all have a iodized salt. Similarly, try to avoid mayonnaise and any kind of a sauces which are readily available like pasta sauce and plenty many sauces. Also try to avoid tomato ketchups. Instead of all of these, you can have a dairy free margarine. You can make your own butter at home from the nuts. Now let's talk about the drinks. So any drink which is obtained from a milk or a dairy based products, you have to avoid. So any kind of a milkshake or a yogurt based smoothies, you have to avoid. Similarly, nut milk, especially the soya based milk products, also you will have to avoid. You can have a soft drinks, but however, if the soft drink color is either red, yellow or orange, that you need to avoid, because that can have a red food coloring dye. So that also you have to avoid. Now let's find out that what kind of a drinks you can have. So you can have all the fresh fruit or vegetable juices. See, try to refrain from buying a packaged or a ready to drink fruit or vegetable juices, because they do contain some amount of a salt as a preservative. But yes, you can make fresh juices at home. If you want to make a smoothie, you can have a dairy or a soya-free nut-based milk smoothies. You can have a tea and a coffee as well. However, that should not contain a dairy-based milk. So you can have a green tea or a black coffee. If you want any kind of a milk, then you can take a help of a nut-based milk like an almond milk, coconut milk or a rice-based milk. You can have a water as much as you want, and having said that, you can also consume a coconut water. Now let's talk about the desserts and sweets. For the sweet taste, you can have all the sugar, whether it is a brown sugar or whether it is a white sugar. You can also have a honey, maple syrup, agave syrup. You can consume that. If you are fond of chocolates, you can consume chocolate. However, it should have 70 to 80% of a dark chocolate. You can also consume cocoa powder, but try to avoid sweet chocolates. The reason behind that is many times that sweet chocolates contains the dairy based products, so that you need to avoid. You also have to avoid any kind of a sweet which is made from a milk or a yogurt. So from a milk we obtain ice cream, and from the yogurt we get a gelato. So those kind of a food products you need to avoid. All the conventional food desserts which has a pudding or which contains any kind of a egg yolk or soya based products, you have to avoid. You can have a jam and jellies. However, you can make them at home. A fruit based jam you can make it at home, but try to avoid ready made jams because many of the time they also contain a red color dye. So try to avoid all of them. Now let's talk about the alcohol. See, having a low iodine diet does not mean that you cannot have a alcohol or any kind of a wine or a spirit. However, you need to speak to your doctor whether it is allowed in your particular medical case or not. One important point you should keep in mind when you are following a low iodine diet is try to avoid as much as a readily available food products and a restaurant based foods. Because most of the time when you go out in a restaurant or you bring the parcel at home, they do use a iodized salt and it might be problematic. So try to make all food at home and consume for this 2 to 3 weeks period. Alright. I hope after watching this video you got some good useful information. If you like my video, please click on the like button. And if you are new to my channel, please don't forget to subscribe so that you get more and more health related information. And there is a bell icon. If you click there, as and when my new video will be published, you will get an instant notification. And below there is a comment box. If you have any of your personal question whose answer you are seeking for, please write to me in the comment box. I try to read them and answer them as early as I can. I hope this low iodine diet video has helped you and helped you in your health and a recovery from your thyroid condition. We will meet again with some new good useful information. Till then, take care of yourself. Namaste.